Hi friends, in this topic of general examination, today I will talk about Icterus. First is the disclaimer. Caring Docs YouTube channel does not provide medical advice and information available on this channel does not offer diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only and it should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of medical expert for diagnosis, prevention and treatment of medical illnesses. There is no endorsement for any brand or company. Icterus is yellowish discoloration of the skin, mucous membrane, sclera, and blood vessels, secondary to increase in bilirubin, that is the bile pigments which have high affinity for elastin tissue. The sites where we look for icterus are sclera, sublingual mucosa, oral cavity, palms and soles, and skin. Scleral icterus is basically a misnomer. It was initially used, but if we see histopathological perspective, it has been seen that bilirubin has a very high affinity for elastin, which is an abundant protein in the conjunctiva, as well as superficial fibrovascular episclera, but not the scleral proper. So one actually is observing the icterus of the bulbar conjunctiva against the white background of the sclera. So conjunctival icterus is often the first sign of hyperbilirubinemia. Hence we should use the term conjunctival icterus instead of scleral icterus. Why do we choose unexposed sclera or conjunctiva? Because when the sclera or conjunctiva is exposed to sunlight, the bilirubin gets converted into soluble form and hence exposed part of the conjunctiva may not reveal the milder form of jaundice. The yellowish discoloration can be normally seen in exposed part of the sclera or conjunctiva, which is called as a muddy sclera or conjunctiva. Normal serum bilirubin levels are 0.3 to 1.2 milligram per deciliter. If the values are 1.2 to 2.5 milligram per deciliter, we call it as a latent jaundice. It is usually not clinically appreciated. When the serum bilirubin is more than 2.5 milligram per deciliter, it is clinically appreciated. We can see the yellowish discoloration of the body without jaundice. For example, hypercarotinemia. Here, body gives a yellowish discoloration, but the sclera are not affected. Patients with hypothyroidism, excessive exposure to phenols or nitric acid, or uh, the patient with history of quinacrine intake may also show yellowish discoloration of their body. The mild jaundice is when only we see that sclera is or conjunctiva is yellow. Moderate jaundice is when the skin also gets yellow along with the sclera or conjunctiva. Based on the color of the icterus, we can roughly diagnose some few of the conditions. For example, if the patients have yellow eyes, lemon yellow eyes, it is most likely due to hemolytic jaundice. When the eyes are dark yellow, it is suggestive of obstructive jaundice. When dark yellow with greenish tinge is there, then it is suggestive of long standing obstructive jaundice due to oxidation of the bilirubin to biliverdin. As we know that jaundice has causes of jaundice can be prehepatic, hepatic, or posthepatic. Based on the history, physical examination, and the lab values, we can differentiate the prehepatic jaundice, that is hemolytic jaundice, from the hepatic jaundice, and posthepatic or obstructive jaundice. Obstructive jaundice is also called surgical jaundice. If we take the history of the patient will give history of normal color urine in prehepatic jaundice. The urine will be yellow in hepatic jaundice. It will be yellow in posthepatic or obstructive jaundice. Stool color will be normal in prehepatic jaundice. It will be it will also be normal in hepatic jaundice, but it will be pale clay like in post-hepatic or obstructive jaundice. Patient will have pruritus in obstructive jaundice. In hepatic jaundice, pruritus may or may not be present, but in prehepatic jaundice, there will be no history of pruritus. If we do the physical examination, patients with obstructive jaundice or post-hepatic jaundice, they will have bradycardia, whereas patients with prehepatic or hepatic jaundice will show normal pulse rate. The pallor may be present in prehepatic jaundice because of hemolysis, but it will be absent in both hepatic and post-hepatic jaundice. So the jaundice will be very severe in post-hepatic jaundice, it will be moderate in hepatic jaundice, and it will be mild in cases of prehepatic or hemolytic jaundice. Patients with prehepatic or hemolytic jaundice may have splenomegaly. In hepatic jaundice, it may be variable, may be present or may not be present, but in post-hepatic jaundice, splenomegaly will be absent. The palpable gallbladder may be present or absent in prehepatic jaundice. It will be absent in hepatic jaundice, but it will definitely be present in obstructive jaundice. The features of liver cell failure will be absent in prehepatic jaundice. They may be present as an early feature in hepatic jaundice. They may be present or may not be present. If present, that can be a late feature in obstructive jaundice. In prehepatic jaundice or hemolytic jaundice, the unconjugated bilirubin will be increased. In hepatic jaundice, both conjugated and unconjugated bilirubin will be increased, and in post-hepatic jaundice, only the conjugated bilirubin will be increased. Prehepatic jaundice because of hemolysis will show increased LDH. Hepatic jaundice will show increased AST and ALT, and in post-hepatic jaundice, there will be disproportionate increase in ALP besides increase in AST and ALT. Urine bilirubin will be absent in prehepatic jaundice, but it will be present in both hepatic and post-hepatic jaundice. Urobilinogen will be present in prehepatic and hepatic jaundice, but it will be absent in obstructive jaundice. The examples of prehepatic jaundice or hemolytic jaundice are thalassemia, sickle cell anemia, spherocytosis, malaria, immune hemolytic anemias. Hepatic jaundice is seen in hepatitis, whether it is due to viral cause, alcoholic or drug induced. Patients with infiltrative disorders or ischemic hepatitis can have hepatic cause of jaundice. Patient with post-hepatic jaundice will be considered in CBD, will be having CBD stone, or they may have helminths in the CBD. Patients with head of the pancreas, carcinoma head of the pancreas will show obstructive jaundice or post-hepatic jaundice. Patients with primary biliary cirrhosis and primary sclerosing cholangitis will also show post-hepatic or surgical jaundice. Mr. Joel Brown has said, "The only thing that stands between you and your dream is the will to try and the belief that it is actually possible." With this, I conclude my today's topic. Thank you. Keep learning.